You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. No more dentures is our discussion today. With us, we have an expert on the topic, periodontist Dr. Doug Heller. Dr. Heller, welcome to the program. Welcome back.
Hey, thanks for having me back, Randy. It's exciting to be here.
Good, good. Now, you've been on the program before, and it's been like 7 years. And we talked on the phone. You said that you're changing people's lives.
Yeah, you know, it's interesting because we did talk 7 years ago, but there's been so many great advances in dental implants. And I'm excited to share some of those with you today.
What?
Well, for instance, the treatment times have been reduced. So back when we first talked, we'd probably put an implant in, we'd let it sit for 6 months, then uncover it, then it'd take another period of time before they'd get the tooth. Today, a lot of that can be done in a much shorter time span.
Now, for people that don't know your practice, and I know you brought photos and models, and we'll get to those, but what's your role as a periodontist, and what all do you do?
Well, as a periodontist, Randy, we treat people that have gum disease, which would mean people that are losing their teeth, have loose teeth, have teeth that are hurting, and are really either trying to save their teeth, or if it's not even possible to save their teeth, are looking for other alternatives so that they can chew and function better.
Okay. Now you use lasers also to kill gum disease.
Right. Well, there's many ways to do it, and it just kind of depends on the person. We do have the ability to use a laser. There's other ways to do it as well. But everybody that comes in, we treat as an individual. So there's no standard way to do it for, like, not everybody wears a size 9 shoe. There's just different ways depending on the person that we would go about treating them. Other things that we do is we help people maintain their teeth and get them go from that disease state where there's inflamed, bleeding gums, things like that, and get them healthy again so that they can keep their teeth, hopefully for a lifetime.
Now you use lasers and everything else.
Yeah.
Like you guys are like as you say, the cutting edge, all the new stuff.
Yeah, we try to stay pretty current with what we're doing. I think that's a valid way to put it. Dentistry is never the same as it was 5 years ago.
It's always changing.
Yeah, it's always changing. There's a lot of technological advances, and we're trying to keep up to date with all of those.
So when patients come in, right, like whether all their teeth have to go or they're a denture wearer, what are the questions? Like, what do they want to know? Are they still skeptical when they come in? Like, what do they say?
Well, obviously, anybody that comes in wants to know that it's going to work for them. Okay. So that's one of the main reasons that we like to see the patient, so that we can look at them, evaluate the quality of their bone, and know that that's a viable option for them. They have other concerns. One is the concern that many of them, particularly the denture wearer, have been through a lot of frustration over the years with their teeth, and have spent a lot of money either trying to maintain them, or they're trying to get out of pain, or they're doing different restorations, and they're frustrated because the money they've spent hasn't been worthwhile, meaning they've had failing teeth, failing crowns, failing restorations, root canals, things like that. They want to know that the money that they're going to spend is going to last them and be a fruitful and solid and very viable decision for them.
So you call it permanent teeth. I mean, with dental implants, you could take somebody with no teeth and give them a full arch of teeth.
Absolutely.
Is that right?
Absolutely. And as the dentist, that's one of the most gratifying things we do. I mean, can you imagine if you, and it's hard for you probably to imagine because you have all your teeth and you're able to chew and eat and do all the things that you want to do. But imagine if you weren't in that situation and you were the guy that said, look, I can't eat this meal with my buddies because it hurts too much because things get underneath my loose-fitting denture. Or when I bite down, something gets underneath it and it hurts the gums. Or not even capable of chewing hard food. Imagine you're that guy. And all of a sudden you have the option where that's no longer the case. You're able to get something that's permanent in your mouth, that you're able to go out, eat what you want, chew what you want. You can eat an apple, you can eat corn, you can eat steak, and you're really doing it for the first time in many, many years since you've gotten those loose-fitting denture.
Do all of them say, you know, I should have done this years ago?
You know what, it's funny. Not everyone says it, but everyone thinks it probably.
Okay.
Because it is really something that really can change their life. And age isn't a factor.
How old can you be to get this? Like to go from like having no teeth to permanent teeth, upper and lower.
From having no teeth to permanent teeth?
Yeah, how old can you be?
Well, the age is not the restriction. Age is never the restriction. My oldest patient was 96 years old.
Really?
Oh yeah, he came in and I'm pretty certain that he didn't think he was gonna live to be 120. But he came in and he got teeth, and then he was so happy with it, he came back the next year. So he was 96 the first time he came in, and I'm not even certain whether he was 97 when he came in the second time, but that's a possibility. But he was thrilled, and it really gave him that quality of life that he was looking for.
Why would somebody want, dental implants or go through that procedure at 97 years old?
Here's the reason that they do it. For instance, let me give you an example. My mom, she's currently having problems with her back. She's got some bronchitis. She's got some other health concerns. Okay, that as you age gets debilitating at times. But one thing that people always want to do and enjoy is the food that they eat. So if you have a fixed set of teeth, it gives you that opportunity to eat whatever you want, and it really is one of life's joys. And even in today's culture, it's really funny because food has become such a big thing for many, many people. And the ability to go and eat what you want, when you want, how you want, and where you want, that's huge. So that's a reason that a guy like that would want to do it.
So a denture, we're talking about denture, and like you said, we were in the green room. You said that you don't get a lot of denture. Those people you could probably help the most, right? It's hard to get them because they've adapted. Is that what's going on? Like they're just used to it?
Well, Randy, here's the real reality of it. There's 35 million edentulous people in the U.S.
Okay.
We could fill all the sports arenas in Colorado with people that could benefit from these procedures.
Why don't they do it then?
Because what happens is they've kind of checked out of dentistry to some degree. They've been through the frustration of teeth that are failing.
I guess they don't go to the dentist if you're a dentist.
Yeah, they no longer go to the dentist, and they don't even know that what's possible anymore. They've kind of like said, look, this is not a part of my life anymore because they don't have teeth, so they think they don't have to go. But when they don't go, they limit the possibilities of what's available to them. And so it makes them so that they go, hey, this denture's loose, but it's the best I got right now. And they don't know that they could have a fixed set of teeth and chew and function and have stability.
I'm sorry for interrupting, but you've had people that have seen you on the show.
Right.
That say, I didn't even know this was possible?
Yeah, they didn't even know it was possible. But not only that, it's not even just that it's possible. Here's the thing. People go through this procedure and they make the commitment to do it. And they go at it with all the best intentions. But the people that really do it, it makes such a powerful impact on their life.
Like what?
For instance, I had a lady who came in and she had a loose fitting denture and she wanted something better than that. So we did a permanent set of teeth for her. And so it's really funny because these people, it's really great because they leave and they have their first set of permanent teeth. And the next time I get to see them, the makeup is different. The hair is different.
Oh, really?
Yeah. And it doesn't stop there. As time went on, she had some cosmetic surgery. She started becoming more active. And not only that, this is a lady that was having so many problems and was limiting her life because she was not really happy and she was kind of hiding what was going on because she was uncomfortable with the looseness and the fit of her prosthesis. But
prosthesis meaning denture.
Right.
Okay.
And now she comes in and she's thrilled to come to the dentist. She loves to see us and likes to get her implants clean. She likes to have us take a look. And really, her whole personality has changed. And I think it's really the result of the change in her smile and the fact that she now has permanent teeth and she can feel comfortable. Okay. She's not worried it's going to click in, click out, clack around, that it's going to fall in social settings, that she's going to be eating certain foods, have the discomfort that she had in the past. And I just think that she's really made a big difference. I think her confidence level, self-esteem, all of that has dramatically changed as a result.
You brought up a good point in our green room. It's like people 60s, 70s are dating. And if you have a denture, It's like you have a dirty little secret. It's like, how do you tell the person you're dating I have a denture?
Right, and the smile is so critical to people. You know, the smile is one of the top 3 things that people look at immediately.
I knew you were going to say that because you're a dentist, a periodontist, right?
Well,
you think it's
hey,
important?
I am what I am.
Okay.
No, it's really a critical part. It's not me that's making up the top 3. Those are studies that show. And it may be 1, it may be 2, or it may be 3, but it's always included
top
in
3
those
of what? What do you mean?
And the top 3 things that people notice about somebody else. And
smile, that's true. It's always at the top.
And people that are not smiling or don't feel comfortable smiling, many times they get discriminated against. People think they're dirty. They think they're poor. They think they're not as smart. They think they're hiding something. They think that they're...
So people with bad teeth are discriminated against?
Oh yeah, I mean, the patients that I've had too, I talked to you about the one patient and all that. I've had many other patients, and when I talked to him about kind of what were the issues and why he came in, one of them was he just didn't feel comfortable, and he was withdrawn, and he just didn't feel like he wanted to smile around people. He'd keep his mouth over it. He didn't really notice until he corrected the issue with permanent teeth. But he said, I didn't really realize that I was limiting what foods I could eat and kind of making choices based on what he felt comfortable eating as opposed to what he liked to eat or would have liked to eat.
So now, I mean, they could eat like chewy pizza, like popcorn, nuts. Like if they get a fixed set of teeth, they could eat whatever they want?
Whatever they want. There are no limits, no limits. So you like popcorn, it's on the table. You like nuts, it's on the table. You can eat what you want. There's no limitations.
So I guess the challenge is just getting them to believe it, that it's possible?
Well, the challenge is to getting them to say, look, here's an option for me, let's explore it, and let's see if I'm a good candidate.
But can somebody be too far gone, like their teeth are too bad, their gums are too bad? Or are most people candidates?
You know what, Randy, it's interesting because maybe once a year that could happen, but it's very, very rare. But here's the perception out there, is that because they had problems with their teeth, they think that they would not be a good candidate for dental implants. And that could
because their gums are too bad?
Because either their gums are bad or they just had problems, they had pain, they think they're not a good candidate.
That's not true.
It's not true. Because actually those really are the best people to come in to have this procedure done.
Now you work as a team though, with the general dentist, together to get this done.
Yeah.
Is that right?
Yeah. So we have the good fortune of working with the majority of the best dentists in Denver. So we've been pretty lucky and pretty fortunate. But the reality of it is, here's why we think that's really a great way to go. I see my doctor for different things, right? I go get a physical, and all of a sudden he says, hey, I want you to go...
To the psychiatrist. I'm kidding around. Go ahead.
He says, I want you to go... get your heart checked or whatever.
Okay.
He's not the guy that's doing it. He's sending me to the specialist, the guy that does it day in and day out, and that's what he does, and that's what he does well.
Okay.
So as the surgeon and as the periodontist or the guy that's putting in the dental implants, that's what we do, and that's what we do really well.
So you're the specialist. Can they go to you directly, or do they need a referral?
No, anybody could come see us directly.
Now they see it. Now people don't like going to the dentist, especially the specialist, because they know they're in trouble. Do people ever say that to you? Like, no offense, doctor, but I don't like coming to the dentist?
Oh yeah, all the time we get that. And the reason is, and particularly the denture wear, is because they're not happy with what they have, number one, and they're not happy with what they had prior to having the denture. So they've been through a big money pit of spending money for things that didn't work out for them over time. And whether that's because they didn't take care of it, or whether they neglected things, or they just had a bad experience. So we get that a lot. Like, I always tell people, we don't have a line on Saturday out the door because people love to come see the dentist.
So you brought some photos. What are we looking at?
Yeah, no, this is my patient, Ken. And Ken was one of these guys. He had a lot of loose teeth. He was in pain. He always said that he had a lot of sensitivity, particularly to cold. His teeth were starting to move on him. He knew things were getting worse, and he wanted to take care of them before they got even worse than what they were. The fact that the dental implants came along, and I always say they're the eighth wonder of the world because
the eighth wonder of the world are dental implants.
Oh yeah, it's the eighth wonder of the world. because it allowed him to get a permanent set of teeth. And it was interesting because we talked about kind of what his comment to me after it was done. He said he was overwhelmed. He said, he couldn't believe how great it was. And really his main quote he said to me was, "I was pumped." And I asked him, and I said, "Hey, how else has it affected you?" Because he comes in, he's always happy. He's really, a very social guy. And he said that not only that, he said that since he's gotten his teeth, he's had 2 promotions in his job. And he said,
just because of his teeth?
Well, I can't promise everybody they're going to get 2 promotions just because if they do their teeth. However, with Ken, he said, look, here's the reality. He said, where I used to hold back and I was self-conscious about my smile and my teeth, and I didn't really even notice it that much. Now I'm more aggressive and able to participate in meetings. And as a result, he did say,
so self-confidence is up.
Yeah, his confidence, his self-esteem, all those things improve. And it improves immediately. People go out, we talked a little bit earlier about, initiating romance and all those things. It's not just the foods you eat, but it's the things that you do. We're in Denver, Colorado, okay? Ski capital of the world, right?
Yeah.
So let's say you had a loose fitting denture and you're gluing it in and you're not sure if it's gonna stay in. How are you gonna go out and go ski in the area?
So skiing with a denture has gotta be tough, right?
Yeah, because you're
thinking about it.
Can it be done? Yes, it can be done. But what the reality is, always in the back of your head is, when is that moment going to happen?
Because if you take a spill,
is it going to fall out? Am I going to lose it?
It's a good point.
Yeah, and those are always in the back of every denture wearer's head. They're used to putting in that glue. This isn't a way that they can now eliminate that entire process.
And it doesn't really hurt that much, right?
You know what? That's the crazy part about dental implants, okay? So the perception out there is dental implants are aggressive, they're gonna hurt. Okay, it could not be further from the truth. In fact, of all the procedures we do, and we talked a little bit at the beginning of the show of some of those, this is by far the least painful, least traumatic, and most beneficial that patients
because the bone doesn't have like feeling, right?
Right.
It's only the gum tissue that's sore.
Right, and so I can't tell you how many times people will tell me, I took a medication the day of the procedure and that's it. And probably the only reason they took it the day of the procedure is because we ask them to and tell them they need to do that.
Now, majority of these people, okay, so the process, they come in, let's say that you have to do extractions, give them dental implants, give them a full arch of teeth on the upper and lower. But during the procedure, they're being sedated, like IV sedation, oral sedation?
Yeah, people can get IV sedation if that's what they want. The reality, Randy, is it's such a benign procedure that most people don't even need it.
You just give them like a pill?
No, it's just local Novocaine, just like doing an old filling. It's the same anesthetic.
Is that right?
Yeah, it's really great. And not only is it great, but it's simple, it's easy, and it's relatively quick. So
Do you think you could wipe out dentures in Colorado? Or at least Denver? Like no more dentures?
It would be nice. It would be nice.
If they knew how good it would be, they would all do it, right? Now, both groups, the people that their teeth are falling out, they can't even eat and chew, and then the people already have dentures, that if you could give them a fixed set of teeth over the weekend, like a tryout, like a test drive, nobody could go back. You believe that?
Absolutely. It's funny that you mentioned that, because if you did that, either A, they'd steal your car because they'd never come back and give it to you because they'd be thrilled at how it went. And secondly, when they had to come and give it back to you, that would be a problem because they would say, no way, I'm not going back to this.
It's that good. I mean, well, obviously you've never had a denture, but they tell you it's that good?
Yeah, it just changes people's lives. I'm told you, it's confidence, self-esteem, ability to go out in social settings, dating, participating at work. I have another patient who she ended up in the same position. All her teeth were failing, and she knew she needed to do something. So we got a chance to help her. So in talking to her about it, I asked her, hey, how is this affecting you? Or what are the things you can't do? Well, she couldn't eat, as we said, she couldn't eat the foods that she liked.
When you say failing, that means that this is a woman you're talking about that her teeth are like
migrating.
Like they're bad.
They're bleeding. Lots of problems. And it was limiting her, not just at work, but in her life, because she didn't feel comfortable going out in social, even with her friends. She always would keep her hand over her mouth, which is very, very common. And so when we talked to her about what are the possibilities, the permanent fixed set of teeth was what she wanted. And it's great because...
Do they say that? They say, I don't want teeth to come out? Like, how do they say
Yeah,
it?
absolutely. They go, look, I want something that's permanent. But some people don't even know that that's a possibility for them. So there's different options as well. But if you want something that really is going to make it so that you can function better than your old teeth, then that would be it, the permanent set of teeth.
That don't come in and out.
Correct.
And you don't have to think about them. You just go get them cleaned once every 6 months, whatever.
Yeah, you still have to take care of them, and you still have to come in and get them cleaned. But realistically, it's probably the least costly long-term dentistry they can do.
Now, we should mention, I mean, you're an experienced guy. Periodontist, you're a specialist. Right. You've done, I asked you when we started, over 5,000 of these procedures. So you have a lot of experience.
Right.
And there's a lot of guys that are just starting out doing this. And you probably have a bias. You're a specialist. You think people should deal with a specialist when they do this?
Well, you know what, Randy? It's interesting. Should they deal with it? Absolutely. And let me tell you why.
Does it cost more to go to a specialist?
No, it's the same fee. I mean, basically the same fee. But the difference is somebody that does the same thing over and over again does it better, quicker, faster, and makes it easier on the patient.
So you brought more photos.
Yeah, so anyhow, this was the patient that I was telling you about earlier.
Oh my goodness. I
mean, her teeth were they were splinted together, but they were flailing in the breeze, and she couldn't eat.
That's got to be unusual, right?
No, it's not. It's not. I mean, there's 135 million people are either missing one tooth or a combination of teeth in the U.S. So
they just never smile? Is that why we don't see them?
They don't smile. They keep, when you see them in their family photos, they're the ones with their lips pursed together. They look unhappy. They don't look joyous. They don't look like, that they're enjoying life. And so you give somebody something that's permanent, that they have confidence in, that's going to really, that they just know is right, and that's going to allow them to do the things they want to do. So
charisma enhances, obviously, with a better smile.
Self-esteem. So self-esteem is probably the number one thing that increases like that.
So what are her options?
Okay, on the upper teeth, Randy, she needed a denture, but she didn't want a denture. She wanted something that was permanent. And so we were able to give her a fixed set of teeth, and the advantage to that is twofold. One, it's permanent, but the other is she didn't have to have something that covered the roof of her mouth and limited her ability to chew and taste food. On the lower arch, she also thought she needed a denture. In reality, she didn't need a denture. We were able to save some of the back teeth, and we used dental implants to replace some of the front teeth. So she got really the best of all worlds because she was able to save some of her existing teeth, and she was able to get a permanent set of aesthetic teeth that freed up the palate, let her chew and taste different foods. Look at the before and look at the after. Aesthetically, it's beautiful. And you don't think that makes a difference to her?
Yeah.
When we talked, we were talking about kind of what's gone on in her life since she's gotten it. And she was telling me, look, we used to do these potlucks at work, and I just wouldn't go. I just wouldn't go because I didn't want to have to, worry about what I was eating or cover my mouth. I didn't want people around me. She also told me, this is pretty something that I couldn't even relate to and never really thought about. But she goes, when I worked, I wanted my door shut. I didn't want people coming in. And now I have no reservations. She goes, I'm smiling, I'm happy, I'm out there. It's really changed my life.
Like she's back to where she used to be, right?
Absolutely, yeah. It's energized her. It's made her feel younger. It's amazing.
Now we should mention that, and we are out of time, but that Medicare, Medicaid does not cover dental implants here in the U.S.
Right.
Insurance, even the best dental insurance in the world, maximum payout might be $2,000. So it doesn't cover the whole procedure. However, you have financing.
Right. So we will make it affordable so that patients can get this done. It's like your car, Randy. If you went and bought a new car, chances are you would finance it.
I do finance it, sure.
That's the way of the world these days. So it's possible, and it's a great way. If everybody knew how great it would be, they'd be there tomorrow lined up to have this.
Is that right? You couldn't handle a business.
We could not handle it.
And the teeth could look good. They could look real.
No, they don't look good. They look great.
Okay.
Yeah, no, this is like telling you, Randy, the eighth wonder of the world.
Eighth wonder of the world. So really, look, all kidding aside, nobody should be wearing a denture. A standard denture. It should be attached to something.
Correct.
Do you believe that?
Absolutely. Absolutely.
And
if I could, if I could just beg him to do that, it would help them so much.
Options for denture wearers. Okay. We have about a minute left.
So one of the options for a denture wearer, and this really kind of addresses some of the loose fitting denture, is to do just two implants lower front of the mouth, and it is a snap in, snap out denture. The snaps can be adjusted so it goes into the implants and you can hear it click in. And it gives it the stability that it's not going to fall out.
No more adhesive?
No more adhesive. So that's
what could
the
they
advantage
eat with that?
They could eat a lot of different foods, but there's still a little bit of play from front to back. Okay. So a better option is if you can do 4 implants, and imagine the difference between the 2 where it rocks a little bit front to back, and now you have 4 and it's like a chair.
So still full arch of teeth.
Yeah. So imagine you're sitting in a chair with 4 legs. It's very, very stable.
Okay.
So that's a great way to go. And that could either be permanent or removable. Okay.
But that's what people want, right? I mean, teeth that don't come in and out.
Absolutely. I mean, the permanent teeth is by far it really replicates what they used to have.
Now, you have 3 periodontists under one roof. They call you guys the dream team, like the go-to people for dental implants over there. I know you're humble about this.
They don't. Who knows what they call us?
Okay. We are out of time. But somebody watching this, and they're either headed to dentures, their teeth are no good, or they're already wearing a denture. Maybe they've seen you on TV, because we've been on for about 7 years, but they're still skeptical. They still can't get themselves to do something. What do you say to them?
Well, what I'd invite them to do is to come in and talk to us, and let's find out, and let's really get down to how we can help them get either a permanent set of teeth, or at least get their either existing denture more secure, so they can eliminate the glues and the discomfort of something that's moving around in their mouth.
Because they've seen you on TV, are you ever recognized around town?
Well, I grew up in the town, Randy.
But do they recognize you from TV? Sometimes?
Every now and then.
Do they ever ask about me, by the way?
Yeah, they always ask.
Always do. I'm just kidding around. Hey, I want to thank you for coming on the show. Always a pleasure.
Yeah, I enjoyed it.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.